Happy Wednesday, everybody. It's Andrea Leonard with the Cancer Exercise Training Institute. Today we're going to talk about limited range of motion following a mastectomy, lymph node dissection, radiation, breast reconstruction. They can all be possibilities. Oftentimes somebody undergoes radiation and they have their surgery, and then a year later they may go back and have reconstruction. There's already scar tissue and adhesions that are built up, and then more is kind of laid down, if you will. So if we introduce strength training before we get the range of motion to acceptable norms, we're really doing our clients a disservice because they're only going to be strong in that limited plane of motion. So when you are looking at flexion, you need to make sure that they are not cheating. So it's as if they have two panes of glass that they have to go between. If they are going up and then they go out to the side and then go, hey, look at me, I've got 180 degrees, that's not true flexion. Very much like if they're doing abduction and they shift forward and go in and go, hey, I've got 180 degrees. We want to take the measurements the same way every time, making sure things are as consistent as possible. Now, ideally, you want to use a goniometer to measure joint range of motion, but if you're just starting off, at least be able to eyeball it. And we have certain norms that we use. So for example, both flexion and abduction are 150 to 180 degrees. So a couple things to consider. Now, this is norm according to the general population, but let's say this is the person's unaffected side, and if in the absence of any surgery or treatment they can only go, say, 135 degrees, then that might be their norm. So therefore that might be a realistic expectation. But if this arm is 180, suffice it to say that they can probably do the same on the other side. But at the very least, they need to be at 90% of that lowest number. So the 90% of 150, if they're not at least at 135 degrees, then I don't want to do something, pretend I'm laying on my back and I'm, doing a pullover with weights. Why would I want to do that if I can only raise my arms to here? I'll only become stronger in this limited plane of motion. So continue to do range of motion exercises like a forward wall walk, or even stretching arms out on a table, or downward dog, modified, mind you, for somebody who's undergone a mastectomy. You can look at our yoga book for modifications on that. But think about what it is you're trying to accomplish. If you're trying to increase flexion, then do things that are specific to flexion. And whether that be a yoga pose, if you're doing a yoga pose, holding a pose for a certain period of time is going to prove to be more of a strength training exercise. But if you did it with movement throughout your class or your programming and kept it fluid, then it would be more about range of motion. So it doesn't matter, what form of exercise you're doing, whether it's Pilates or yoga or weights or whatever, you can adapt it to whatever modality you use. So same thing with abduction. Now, it's not very often that we're, doing jumping jacks and we've got weights in our hands. So what do you actually do that you raise weights overhead in abduction? Not much. But if you have somebody doing, let's say, snow angels on the ground where they're not working against gravity to raise their arms up, then that might be a better way to increase range of motion. And maybe you're doing some PNF stretching or some active isolated stretching to improve the range of motion versus them doing it up against a wall, and then they've got to work against gravity at the same time. If you want to increase external rotation, what's the best way to do it? Maybe have them lying on their back or even standing up and focusing on external rotation. You can give them some active isolated stretching and push their palms back just a little bit, or if they're laying down, doing the same thing. Internal rotation, same thing, and then of course extension. So as they are pulling away, they've got all this tightness in their chest, limited range of motion, and they're trying to go backward. It can be very difficult. So exercises like dips or straight arm press downs, anything that's going to require extension, If you have limited range of motion and you're trying to do that same exercise, you're not going to get the desired results. Get the range of motion first. Once you're at 90% or better of that lower number, so 150 to 180 for flexion and abduction, 40 to 60 for extension and internal rotation, and 70 to 90, I don't know if I said internal rotation, 40 to 60 for internal rotation and extension, and 70 to 90 for external rotation. Now, these numbers vary according to what organization is providing them, but these are the ones that we use. Once you've achieved that 90%, you can still do range of motion exercises, but now you can start working on the strength training exercises that will correct muscle imbalances. And next week I'll go into correcting muscle imbalances with the appropriate combination of strengthening and stretching. And then I want to also just real quickly introduce pound palms. We're coming up with this new program in the next couple months, pound palms for breast cancer recovery. And the beauty of this, these are 1 pound weighted pom-poms. And we can go through all of the same range of motion exercises. And if you think about various cheer moves, they have the same range of motion as we use for lymphatic drainage exercises. So that's coming up soon. We will have choreographed cheer exercises for breast cancer recovery. So excited to share this with you. In the meantime, if you have any more questions, you can call me at 503-502-6776 or visit our website at www.thecancerspecialist.com. Have a great day.